Recording in progress.
Okay, we are streaming live on Facebook now. Oh, here are some more family members of yours have arrived. Okay, let's begin. Kinjal, would you like to do the honors?
Of course, my pleasure. So, hello everyone. I think ઘણા વખત પછી આજે હું પાછી આવી છું. Normally last couple of times I was managing. આજે we are really honored to have Dr. Chirag Pandya with us. એમને માટે શું કહું, he is a pulmonologist by profession, and a main thing is he is a specialist in critical care and also sleep care. So આજના અત્યારે જે આપણે we are going through this COVID crisis, he is in middle of that. And I'm sure he has seen people around him go through COVID, people treating COVID patients, and the general environment around this whole COVID scenario. So I feel happy. I'm more honored because he happens to be our family member also. So double pleasure for me. Welcome, Chirag. And the stage is all yours, I guess. I don't want to take too much time.
Thank you, Kinjal.
Thank you.
Want to just give a few words to let everybody who is attending this call know a little bit more about Chirag Bhai. Chirag Pandya is the medical director of Stanford Healthcare, and that is a big deal for us here in the Silicon Valley. He is the medical director of facilities that are not only used by several patients, but they are in high demand. And the more I researched about Chirag Bhai, the more I found that he is so well loved. He is very well liked by his patients. They consistently use words like he is very concerned, he is very caring, he listens to his patients, and he is open to get appointments even though he is extremely busy. He is part of several clinics and holds positions of a lot of importance. Now you can understand how great this is, because for a lay person, if you are very ill, first of all, you don't get any appointments. Then if you do, they give you 7 minutes. Here you have a doctor who is showing extra concern. Not only that, he helps the patient to interact and communicate and be a part of their own treatment process. I think these are very, very valuable indicators that we have a fantastic doctor as our speaker today. However, the patients' voices are only a part of the scene. He has a huge set of credentials on his background, and I would not like to make a mistake of not mentioning those. So Chirag Bhai began his studies of medicine in India at the Pramukh Swami Medical College. After that, he came to Cleveland for his residency, and he was certified by the American Board of Internal Medicine. The specialization was in pulmonary disease. Following that, he had a second fellowship at the Detroit Medical Center. Again, the Medical Board of Internal Medicine gave him a specialist credential in critical care. The third fellowship that at least I found out about was at Stanford University Medical Center, where he got a third board certification in sleep medicine. So he is an exceptional physician by all accounts. He has a number of scholarly publications to his credit and over 2 decades of experience. So welcome, Chirag Bhai. We are honored to have you with us. The topic is so live. So many people have questions about it. Unfortunately, so many people have gone through COVID-19, some not having emerged successfully. So please enlighten us. Please tell us what we need to look forward to in the future.
Thank you. Thank you so much for the kind introduction and welcome message. And I'm glad when you search things, you found good things. I'm glad you did not find anything bad. So that's a good feeling to start with. So no, thanks for having me and, taking time on a Saturday afternoon, with, these days with things going all the time and now things opening up and, everybody getting busier. appreciate everybody to take time and coming. What I have done here is that I'm going to try to focus on what COVID-19 is, what coronavirus is, and how it affects people, and what can be done to stop the spread. I mean, a lot of information has been out there for more than a year and a half, and I will just try to share some of the common treatments and what we can do, and then we can kind of open it for discussion or questions as well. Does that sound okay? Great. So I will share. I have some slides here. I'm going to try to share here, and let me just put this out there. There we go. So I hope you guys can see this. Yeah.
Yes.
Okay. Great. Thank you. So this word, COVID-19, unfortunately, is become very common with the pandemic, and all of us are familiar. And if you break it down, what COVID-19 stands for, so it stands for basically coronavirus, and D stands for disease. So it's a coronavirus disease that was detected or first identified in 2019, and that's how the word COVID-19 came out. It's important to know that it's a coronavirus disease because it's much more than just virus infecting and causing a cold. It affects the lungs, it affects the heart, it affects the entire blood clotting system, it can affect the brain, it can affect the kidneys. So it affects pretty much all the large systems of our body, and that's why it's a disease, and something that has become a worldwide pandemic, and we are still trying to get hold of it. So just few slides about what the virus looks like. If you break the virus down and look under the specialized microscope, this is the way it looks. If you cut it across and look inside, the most important part of the virus is the middle ring kind of structure, which we call as RNA. And RNA is where the virus keeps all the genetic information. This is how the virus multiplies and goes from one to another 100, 200, 300 different kind of viruses. And another important thing to know is that pink structure that you see outside called spike protein. So you can see all around the virus, there are this probes or spike-like structures, and these are the pink structures called spike protein. It's important to know this because this is the structure that comes in contact with any part of our body as soon as the virus enters, whether from its nose or mouth when we breathe in, or we touch something that has the virus on. As soon as the virus enters the cell, this is the part, the spike protein, that comes in contact with the surface of the cell. And this is how it enters inside the cell. Another picture, in this case, the spike protein is colored in red. So you can see it is on the top of the surface. It's like the virus is spinning, is going. And this is the part that kind of catches the surface of the cell and then spreads and enters the body or other cells. If we compare the structures of the virus, and if you look at the virus structure, which is all the way to small, it is something that we can compare and see. So the middle cell, which is the red blood cell, which is the common blood cell we all have in the blood, called red blood cell. And the virus structure is small, which is all the way to the left. So you can compare and see how small the virus is. It's 0.1 microns. It is smaller than the bacteria. It's smaller than the red blood cells. So it's not easy to detect or see from a standard microscope. How does the virus spread? Virus can spread by something called droplet, where somebody is sick with virus or somebody is carrying the virus, coughs or sneeze, and all the droplets come out from the spit or mucus or saliva. Or sometimes the virus itself comes out as a contact, but it can travel in air and then stay in the air too, which is called airborne transmissions. There are two ways virus can spread: droplet and airborne. And it's again important to know the size of the virus is very small. So if you look at the picture on the bottom right, the size of the virus is less than 5 microns, and the size of the hair is around 60 microns. So you can see how small the virus is inside the droplet. Very hard to see, very hard to figure out just looking or trying to identify from a naked eye or a regular even microscope. What about the timeline, how the virus spreads? So I know this is a busy slide, there are a lot of things, but there are a few things I just wanted to highlight. That once someone gets exposed to the virus, let's say somebody gets exposed to someone who has virus, who is sick, by coughing, cough, a droplet particle, or coming in contact, then it can take up to 5 to 6 days, or sometimes as early as 3 to 4 days, before that person will start having symptoms, whether it's fever or cough or body aches or chills or any of that. So first 3 to 4 days, you might not have symptoms. It's important to know, because if you are exposed to someone who definitely has the virus, then you might feel fine for 2 to 3 days, but you have to make sure you take all the precautions to not infect others by wearing masks or not touching or maybe quarantining yourself, because it can take up to 4 to 5 days before you will start having some symptoms. Once the symptoms start, and again, it can be as something as simple as having a little bit of fever, all the way to feeling a lot of cough and shortness of breath and things like that. The virus is very infectious for first 5 days. So someone who starts having fever or cough, first 5 days, they're likely to spread the virus to others at a high level. However, they can spread virus up to 10 days. That's why up to 10 days these days, we recommend someone to have quarantine when they are sick or when they're infected with the virus. So previously with CDC, we used to recommend 14 days, 2 weeks, sometimes 2.5 weeks. When we started doing this, which was like, sometime March last year, 2020. But these days we learned that up to 10 days is the time that it can be most infectious or infectious. And after 10 days is okay. So it's important to know this timeline. And then there is this period called post-infectious period, which is 10 to 12 days after somebody has been infected. And it's important to know this period because someone may feel fine, they're not infectious, but if they're getting tested for some reason, tests can come positive up to 14 days, 15 days, and sometimes up to 21 days, so 3 weeks. So if you need to be tested and you have been sick or exposed, you may want to wait if you're looking for a negative test, because the virus can stay when you get tested up to 3 weeks, on average about 17 to 18 days after infection has happened. Just a good idea about the timeline about that. Very important to know, after we learned about the droplet transmission and after we learned about the airborne transmission, what can be done to stop the spread. Again, most of you and all of you are very familiar with these things, keeping the distance about 6 feet apart. If you are having symptoms, especially you're using the tissue or you're using hands, make sure you wash your hands or throw the tissue away, and make sure other contact surfaces are not involved, especially when you are in the public. And these days, the big question is whether you're vaccinated or not. So if you're fully vaccinated and you don't have any symptoms, you're in the public and you're in the areas of the country or part of the world where COVID infection is not very, very active, then you don't have to wear a mask. For example, here in the Bay Area, California, fortunately, our vaccination rates are very high, up to 70% and higher population is vaccinated. So we feel comfortable now going out since we are vaccinated, not to always wear the mask in public, but there are parts of the country where vaccination rates are very low. And in those cases, if you're traveling, for example, you're traveling to Louisiana, Missouri, or parts of southern states in US or other parts of the world where vaccination rates are not high, even though you're vaccinated, you're out in the public, you should wear a mask to be extra safe. Keeping the surfaces clean. If you're sick, staying home, washing hands, these are other common measures. But in context to vaccine right now, it's important to know about when to wear mask and when not to wear mask. It all depends on where you are traveling and how are their vaccination rates for that particular state. Very important to focus on these measures now in 2021, this year than ever. What to do or what can we do to keep our lungs healthy? Because end of the day, if the lungs are healthier, then even though you get sick with COVID or other variants, different types of variants these days, we are dealing with Delta variant in India. They're having a Lambda variant. So different types of COVID virus is coming out. Very important to keep the lung healthy, avoiding smoking, avoiding around people who smoke all the time, avoiding smoking or avoiding smoke from any other issues like industries or pollutions, outdoor or indoor air pollution, working in older buildings. If you're working in an environment there is a lot of smoke or pollution, very important to focus on doing exercise, eating healthy diet, fruit, which has good antioxidants, as well as doing regular exercise, aerobic exercise. These things are going to keep the lungs very healthy. And there is some evidence that vitamin C, 500 milligram to 1 gram, if you take it, it can improve the immunity and it can work as a pretty strong antioxidant. And that can help improve lung immunity and lung health as well. So these things should be on our minds all the time because again, coronavirus and COVID is still not gone, and we will be battling with this, for another year or two, who knows how long, but very important to focus on keeping the lungs healthy whatever possible. If you have someone who might have infection with COVID, or if you have some of these symptoms, they could be related to COVID-19. As I was saying earlier, it could be as simple as having low-grade fever, body aches, chills, but sometimes it can be difficulty in breathing, muscle pain, sore throat. Sometimes it's just loss of smell or loss of taste. And sometimes it's congestion in the nose that is just not going away. Sometimes it comes as GI or stomach upset, diarrhea, vomiting, just not having a good overall bowel movements, and you have your pain. So in these cases, it could be related to that. Exposure to someone who might have had COVID is very important. If you have traveled somewhere where there is more COVID virus, if you have somebody who has been sick with COVID and been around you, especially if you've been around somebody who is not vaccinated and having these symptoms, then you have to be careful, because even though you are vaccinated, fully vaccinated, you can still get infected with COVID-19 if you're around somebody who is not vaccinated and is having all these symptoms. And you may not get very, very sick, but you can still have fever, cough, and those symptoms, even though you're vaccinated. So very important to recognize these symptoms, because this could be someone with COVID, especially if they are not vaccinated. Other symptoms to remember is sometimes there is a change in the color of the toes. We call them COVID toes, which could be the earliest symptoms. Sometimes it's just spots on the skin, which will just not go away and suddenly appears with some fever, a loss of taste, vomiting, which are not common symptoms, but that could be part of the COVID-19 as well. But common symptoms, if you look at it, the 5 common symptoms that we have learned, and something that you should remember so you can recognize someone who might have COVID, is fever, dry cough, trouble breathing, having sore throat or throat pain, and then headaches. These are the common 5 symptoms that we have seen among patients with all different ages, kids all the way to adults and older folks as well. So important to know these common 5 symptoms. How do we detect the coronavirus or COVID-19 virus? There are different ways to do the test. There are tests available where we can check the virus itself, which is called the detection of the virus. Or there are ways we can detect the antibodies, which are the substances our body will produce once they are exposed to the virus. So if you focus on detection of the virus itself, there are two tests available. One test is called the RNA test, which is the commonest and the most effective and the most reliable test. This involves taking a swab with basically a sample that can be taken either from the nose or it can be taken from the mouth. They will ask you to either open your mouth or just stick a probe in the nose, depending upon how much of their concern is for you have COVID-19. They can go deep nasal or deep all the way inside the nose or superficial. That test can take, if you are running a rapid test, can take up to, these days, 30 minutes to 40 minutes. On average, 3.5 to 4 hours, the results will come back. But as you can see in the bottom, the sensitivity and specificity is 100%. So that is the best test to get. These tests have started to become available at home now also. You can buy them at Walgreens, CVS, Costco. You can go or order them online and they will mail it to you, and you can take a sample from the nose and put it inside and they will test it. The home tests are about 70% reliable, because the factors are there in terms of how good of a sample you are taking, what happens during the travel, if it's the mail gets delayed, or if it's kept in a hot environment, it can change the sample. And even though somebody is positive, it can come falsely negative. So home tests are good tests to do when you're doing it for, let's say, travel purposes. You have to go to a country or a meeting or a event where they require you to have a COVID test which is negative, and you don't have any fever, cough, any symptoms, and you are fully vaccinated. You can use the home test as a reliable test to use it. But if you are having, or somebody is having fever, cough, they are short of breath, they're not feeling well, and you are doing a home test, and the home test, you mail it, results comes negative, but that person is still not feeling well, then that home test is not reliable. You have to go to nearest urgent care or your doctor, or call your doctor, because then you have to get a proper deep nose sample test. So that's where the home test fits in. These days testing can become very easy. Most hospitals, most clinics are offering drive-through testing. So you just call or use your app on the phone to make an appointment for the test. That's the way we are doing at Stanford. We have a app-based system where patient will go schedule their test or call a number. They will come as a drive-through, lower their window, nurse will get a sample and will get results in another hour or two. So that's the best test and the best way to do it, which is the RNA test, or sometimes called as an mRNA test. Second test is the antigen test. Antigen test is also a test where sample has to be obtained either from the nose or mouth. The challenge with antigen test is it's not as sensitive as mRNA test, especially in the early stages. Even though somebody has fever, cough symptoms, you do in the first 5 days or 6 days, it can come negative. That's why we hardly ever do antigen tests, and antigen tests has just become not very popular because reliability is always a challenge unless you're doing after 5 or 7 days. And by the time we need to know before early on somebody has COVID or not. So we hardly do that test. So RNA test is the test to go with. And the last test is the detection of the antibody or antibody test, which is something you do like a regular blood test. And what it's looking for is just that, is looking for a memory or evidence that you were either exposed to COVID-19 virus or you were sick with COVID-19 virus. Then your body will produce the response, which is antibody, which is something we'll produce for any infection, whether you're pneumonia or any infection. And these tests are something you can do by giving a blood sample. There are 2 types of antibody, IgM, IgG. IgG is something will mean that you've been infected by the virus a long time ago and you have built a memory. IgM is something you were infected by the virus very recently, and your body just produced the antibodies over the last few weeks or few months. Again, antibody test is not very popular, not something unless you're in a healthcare environment and they're looking for your immunity level. It needs to be done, but otherwise, once you are fully vaccinated, you don't have to go and do the antibody test to make sure that you have antibodies, because if you're fully vaccinated, you will have it, and it's not something you have to always do. So this is a picture of how do we get the sample. It looks scary and painful. I had it done a couple of times myself too, and I'm sure a few of you or many of you had it done. So this is the most effective way to do the sample. We don't do this sampling anymore unless somebody again is having fever, cough, shortness of breath, all the symptoms, and we need to know 100% somebody has COVID or not. In that case, well, yes, we'll put this long sample that will go from the nose all the way to the back. And you can see the sample is taken on the back of the nose where the sample is. If you are just looking for proof of any infection or not, and you're not having any symptoms and you're traveling, then you will not go this deep. You will just go like halfway in the nose and do it. So, but this is the proper way to do it when you're looking for 100% proof. Some findings that I just thought I will share with you, that what the findings in the lungs look like. And unfortunately, I have seen many of my colleagues have seen many of these sick patients with COVID-19. If you look at the chest X-ray on the bottom right all the way, top right all the way, that's a normal chest X-ray. And let's see if I can move my mouse there, but I don't think it's allowing me. But the top right is the normal chest X-ray. You can see that it's looking, like a clear black shadows, hard in the middle, lungs on both sides. But if you look at the X-ray on the left side of your screen, then that's where you can see those 3 arrows pointing. And that just shows, if you compare that X-ray with the top right, which is normal, this is how COVID-19 affects the lungs. It destroys the architecture, it damages the lungs, and creates these white shadows, which you can clearly see that something that you can see from the X-ray. And wherever we see the white shadows, and if you look at the same shadows in a detailed scan, like a CT scan, which is on the bottom right of the screen, you can see that those hazy white shadows is the damaged lung. And in this case, that lung is something cannot get oxygen through into the blood. And that's why the patients with COVID-19, even though we give them oxygen, their oxygen levels are low for a while until this lung heals. And one of the biggest challenges compared to pneumonia or flu or other virus, COVID-19, the healing is very, very, very slow. And that's why it's very difficult to treat. And no matter what we do, after we lose the first 7 days and somebody comes sicker after the first 7 days and they are sick like this, it can take up to 2-3 weeks, sometimes 4 weeks before the signs of healing will begin. So that's why these patients are sicker, they stay in the hospital longer, and the whole recovery process is very long. And that's what is made difficult sometimes. When we were in the early stages of the pandemic, it was hard to get beds and hospitals were filling up, because once the patients are sick, it just takes them time to get better. So because this is the way the lung damage unfortunately happens when they are sick like this. So what do we do for treatment? If somebody who has mild disease, just has a little bit of fever, cough, their oxygen levels are normal, they're not very short of breath, in that case, they don't have to go to the hospital. And these are the majority of the patients we have seen in the mild stages. And these days, we, at least here in California, in the Bay Area, we are hardly seeing these patients because vaccination has gotten so good and everybody's getting vaccinated. So we don't see even these days that much. And these patients, we just ask them to rest, take a lot of liquids and hydration. Isolation, they have to be quarantining in the room or a house at least 10 days or so they cannot spread. They can take medication for pain, fever, like Tylenol, pain control. And sometimes we ask them to buy these oxygen meters, which is something that since the beginning of pandemic now has become very easy to get from Amazon. You can go online and buy them, and we give them instructions to monitor oxygen levels every hour, every 2 hours. We have the nurses will call and check on them, and we'll do more of this kind of monitoring. And 70% of patients like this will do well. After 5-6 days, they will start feeling better. And just like flu, they will get better. They don't need anything else. But sometimes, it's a more of a advanced disease. And it's advanced disease, then the biggest challenge is their oxygen level runs low. So we can do all those things at home that I just mentioned, but oxygen levels still run low. They are below 90%. So the key is 90%. If the level is running below 90%, you put a simple oxygen probe at your home. Again, it's a portable meter you can buy online, and somebody's sick and you see the level is constantly running 89, 88, 87, below 90%, then that person needs to be in the hospital or in the hospital setting right away. And in that case, we will give them oxygen, we'll give them medications IV, And one of the biggest and most effective one will be, remdesivir, which is the antivirus medication. However, remdesivir is most effective if it's given within the first 5 days of onset of symptoms. So unless we give that within that time, the effectiveness is very low. So that's why we kind of ask and get a lot of history, and then we'll use it. And sometimes if they're very sick, then they will need ventilator and the breathing machine to support as well the lung function and breathing. Another technique we do in the hospital is something called proning or prone position, which is something that we encourage patients to do at home as well. We just ask them to sleep on their stomach when they're sick compared to sleeping on their back, at least about 14 to 16 hours per day, as much as possible. Because the advantage is that we have learned that COVID-19 affects the bottom parts of the lung more than the top parts of the lung because of the gravity, because of the overall pull, and because if patients sleep on their back, those lungs get damaged more. And when they try to take a deep breath in, they cannot expand those lungs all the way. So we'll ask them to sleep on their chest, and therefore it will allow them to get more air in the back of the lung, bottom of the lung, and it improves their lung function. And we have seen that if we ask patients to do this early on, they will not get sick. They will not always need oxygen. If they are on oxygen, they will get off the oxygen faster. So the simple technique like this has made a big difference. And we have developed protocols all over the hospital. As soon as the patient comes, the nurses will tell the patient to just turn on their stomach and stay like that for 16 hours or so. And we notice that these patients will just not get sick enough to go to ICU, which is great because it was challenging to get enough support. So we still encourage this. And if you know anyone who is suffering, you can ask them to do this. To search online, a lot of information available for this too. Sometimes the patients are sick where lungs are affected and damaged, and they just cannot keep their oxygen level up. Then they will need a ventilator. Ventilator basically is a machine that pumps oxygen with pressure that goes from a tube that is put from the mouth inside the lung. And on top of just giving oxygen, it gives pressure as well. So the lung stays expanded and stays open, because that's the biggest challenge. Unless you keep it open, the lungs will shut down, and then it's hard to recover. So sometimes in extreme situations, we'll use ventilator like this. Sometimes we'll ask patients to stay on their stomach like this in this picture here, who is on the ventilator. So despite they're on the ventilator breathing machine, their oxygen levels are still very low. And we have to put them on their stomach because we again want to keep the back of the lungs open. So we do proning for these patients, even though they are on the ventilator, sometimes they need this as well, which is the last resort we'll use in these cases. Same thing, the principle will apply if we keep them. You can look at these CT scans. This is someone that had COVID-19. And if you look at the image A, B, C, and D, if you go from A, B, C, D, you can see the lungs overall from white shadows, they're becoming more black. Now, more black you see, it's a better sign because that means there is more air and oxygen, because whenever we do the scan, air or oxygen is something on the scan always looks black. So that's what we want to see in the lungs. We want to see lungs looking black. And if you go from A, B, C, and D, you can see how they improve from 1, 2, 3 weeks over time when we do these techniques to keep them sleeping on their stomach, giving them ventilator support oxygen. So they do recover, they do heal. I have seen many patients. I have seen somebody as young as 21-year-old on the ventilator, all the way to 86-year-old who went through this and recovered. But the process is long, and you just have to allow time to heal, and eventually majority of the patients will recover. It's just that they need the support right away and intervention right away to get them there. Yeah. So I think I will stop here, and then I'll see if we want to focus on any particular areas related to COVID, whether it's vaccine or other questions. So I just wanted to kind of at least give the general overview first and see where we are. Yeah.
Thank you so much, Chirag bhai. This was a lot of information to digest, and I've been looking at the chat. We have our monitors who have been looking at the questions. We have some very good questions that have come in, so people are very curious. Let's go one by one with the questions,
Sure.
please.
Sure.
Sure. So, thank you so much, Dr. Chirag, for wonderful presentation. We really appreciate this. At this time, we have got plenty of questions. Like, I am not sure whether we will be able to address. You will be able to address, but I have tried to put them, categorize them in couple
Sure.
of categories, like the virus itself, the question around virus, the question about around prevention of COVID-19, question about around the causes of COVID-19, uh, the COVID-19 disease, and the vaccine. So let me start with the virus first.
Sure.
Uh, so the one of the questions I got, we received was, there are so many variants, that we saw so far. So is it like, will it like ever going to end? Are we seeing end to it, or
Right.
it's just social media which is going to keep us
Right.
informed about various variants?
Right. No, that's a very good question, and that's true. So there are a lot of variants. The first ever virus we dealt with last year all over the world, that was the alpha variant, or the first variant. Which started in Wuhan and then spread to Europe and then US, of course, after that, and we saw all over US. Then the beta variant came out, which is something that's been around, originated from South Africa and the US. And then we are dealing with also Delta variant now, which is originally originated in India, and I'm
Okay.
sure many of you are aware that variant, out of all variants so far, is the most deadly in terms of infectious potential. So that variant, the Delta variant, spreads very fast compared to the original Alpha variant, something we dealt with, and also makes patients and people sicker. So fortunately, the vaccines, if we have seen vaccines like Pfizer and Moderna vaccines, once both doses are completed, and then those two vaccines are definitely effective against the alpha, beta, as well as the Delta variant. All of them variant, they are effective. About the rest of the vaccines, AstraZeneca, J&J, we still don't have a good data, so it's hard to say. We still don't know. But Pfizer and Moderna, we know that they are effective against Delta variant. So the question about are there more variants which will come? The answer is that, unfortunately, yes, there is a good chance more variants will come. So first of all, it's a natural tendency of the virus to form variants, whether it's COVID virus or flu virus or a cold virus, any virus we know, they all have variants which happen periodically. They happen every few weeks, every few months. Unfortunately, some variants, out of all the variants, they just become more deadly and more problematic compared to others. So it's a natural tendency of a virus to have the variants. In terms of the COVID, the challenge with variants is that there are regions outside the world, for example, parts of Africa, parts of Europe, parts of Asia, India, Japan, South Korea, all of these places where we still don't have very good vaccination rates. The virus is still spreading constantly. And because the virus is spreading so fast, and we have some population which is vaccinated, there's some which is not, and people are still out and about. So in those cases, that's something that increases the overall rate of variants, like how fast they form. So we just learned, recently from West Bengal in India that they detected Lambda variant, which is the one after Delta that they are dealing with. So yes, variants are continue to come until we have pretty good vaccination rate, at least about 65-70% vaccination rates in all of the countries everywhere. Until then, the variants will continue to come. So, and that's why I think both Pfizer and Moderna are also preparing to come out with a booster dose. Moderna probably, they have not announced, but they are discussing about 9 to 10 months after the second dose, and Pfizer maybe after first year after the second dose. So there will be a booster coming. We just don't know when, because it's a natural tendency for the virus. But the COVID, the way the virus is, the way the structure is, it's just a lot more infectious compared to other viruses. So their variants are more deadly. But the answer is yes, more variants will come until we have strong vaccination. And it's got to be vaccination that is effective against the variants. So, if we know the vaccines are not covering Delta, even though they're vaccinated, then that's not going to stop the variant. So it has to be a vaccine that covers the variants, which is a challenge getting that kind of vaccine all over the world. So until that happens, variants will come out.
Can I interject one small minute and ask you to explain why this is not the first time that a coronavirus has occurred, that we've had millions of viruses and many of them have also been called corona
that's true.
in the past.
That's right. The answer is the structure, the way this virus is structured. I mean, it has a lot more, like I put a structure out there again on my slides, because if you look at the structure, it has a lot more spike proteins than general virus has. And its RNA basically multiplies a lot more faster than other viruses. So this is not a virus. This is more like a super virus. That's what I'll probably say. This is like, if you were to design a virus, and you design a virus which is like, beats all the other viruses so far, that's the way this virus is. So because the genetic material multiplies very fast, and it has a lot more spike proteins on the surface. So if there are less spike proteins, then it will attach on the cell, whichever part of the body, less, because it needs a spike protein to attach. So more normal viruses don't have these many spike proteins, but this virus has a lot of spike proteins. So it has a high chance of attaching. Once it attaches, it multiplies really fast too. So that's why this virus is challenging. But yeah, I mean, there are different coronaviruses which have been out there for years and years, but they did not have this particular genetic, structure. So that's the challenge. Yeah.
So we have another category of questions coming up from the prevention of the COVID-19. So I will rephrase some of the questions and put them together, club them together. And ask. So especially there is one question about we have viewership and our loved ones, all of us living in India. And when I say India, high density, population density area. So India is almost 12 times more denser in terms of population density than the US, for example. So do you have any suggestion from your experience how they can prevent high density, population density regions can prevent the spread of the COVID-19? And also there was a question about how effective these supplements, vitamin D, etc. And if there is any other supplements which can help prevent the COVID-19 disease.
Right. No, that's a good question. It's hard. I mean, I know it's I think here in US we try to in US and some parts of Europe we have done a good job keeping that 6 feet, 8 feet, even 5 feet distance. Everywhere we go now, we have the signs and everything is marked off on the lines you have to stay or rooms you have to enter. Everything is spaced out. Doing that has made a difference. But you're right. I mean, there are other countries like India, especially, it's hard the space is a challenge. So how do you do when you have space. And this is something that I know that, I mean, it's one of the reasons it's hard to control COVID there. So I know that government, everybody, I think, is trying to do what they can. I talk to my parents about this and my relatives and read online. And but there are some parts where, especially some jobs, when people have to go out and do their job every day to earn their living, and there is just no way they can keep that 6 feet distance to do the work. So in terms of distancing, there are parts or particular job or place or where they live, it's going to be hard for people to do distancing. And unless government comes out with a strong structure, which is again hard to do with at large level like this, it's going to be difficult. But I think the biggest thing they can do is make sure they do surface cleaning, they keep their hands clean, they clean everything they live inside there with, and they will basically wear a mask as much as possible. And again, ask the question, don't go out to big events. I know finally things have stopped, but there were just a few months ago, big weddings, big events were still happening over there. So I think those events is something that people have to take charge and say, you know what, no, I'm invited, but I will not come. Or they shouldn't do event, they shouldn't go, which is something I think at least needs to stop until it's fully controlled. But the distance is difficult. So you can do surface cleaning, you can do mask and things like that. But biggest thing is I think events need to be stopped, because as long as there are events, there are people who are going to go, and this will continue to happen. So that's a big one,
Definitely.
Yeah.
And thank you so much for that answer, Doctor. And let me ask you related to the disease itself now. I have a couple of questions, and I have to basically ask individual questions because they themselves are like different by nature. So let me start with the question about the uh, black fungus. So could you describe uh, like about what is black fungus and how we can prevent that for possibly, and what are the basically preventions that we can take,
Sure.
and what that is.
Right, sure, absolutely. The black fungus is something which is called mucor or mucormycosis. It's basically a type of mold that is out there. It's out there everywhere. And it's not only in India. It's not only in there. It's there all over the world. Every time there is a particular environment that where mold can grow, the mold comes and grows, because this mold is present in old buildings, old furniture, old things which are kept for years and years, and it can be present in the vents which air comes through in the hospitals or buildings. It can be present on the equipment, medical equipment, which is old and not properly cleaned. So it can be on the surface of a lot of things which are old and sitting there for so long. Just like COVID virus, mucor or black fungus is also something that spreads very fast. So it has also that same ability where once you touch something, or once you touch surface and you don't clean the surface, whoever touches it, just going to spread like anything. So biggest challenge is if there is a cabinet or place where they keep the IV fluids, where patients get IVs and intravenous bags or needles or tubing they use, they come in contact, then you can just imagine it's just going to spread from one to another. So I think, and I think this is something has been found as a common issue there a few months ago. And after that, they have done a great work. I talked to my medical school colleagues and friends who are working there, and that's something they have recognized, that they just have to do a better job at keeping everything clean, separate, hygienic, and that will stop this. And after they did that, I think the rates have gone down quite a bit. Second thing is, the reason it was spreading quite a bit is because of use of steroids. Because steroids are something that you can take as a tablet or IV, which is something we use quite a bit here too when patients are really, really sick. But we keep a very close eye. As soon as they start getting better, we cut down the dose, we take them off, we stop the steroids. But I think over there, I think the biggest challenge was infrastructure. When you're at a large level, It's hard to monitor, especially not having enough nursing and pharmacy. And we have so much support here. So I think not having that structure, some patients kept getting steroids or keep getting steroids a lot more than they needed. And when you get so much steroid, it reduces your immunity, and mucor or black fungus spreads rampantly. So that was another big challenge too. So these were the major factors there, which I think have been recognized, and now rates are coming down. It's unfortunate that it happened right around the time with COVID, and it just that's something that is hard to control, because the treatment for that is a medication that is not an easy one to make. It's a very complex medicine to treat the black fungus or mucormycosis, amphotericin B, and because it's just a hard medicine to make, so you just cannot keep up the way the mold was spreading. And that medicine has a lot of side effects too. It can affect the kidney and liver. So when you're trying to kill the black mold or mucor, you are dealing with other side effects with that. So that's why it became more difficult. So
I see.
Yeah.
Thank you for this information.
Problem.
Let me ask a second question about the disease part. So this is about children. So we have seen, what is this multi-system inflammatory syndrome caused during or after COVID-19 disease? Could you tell us about, because we have viewership, a lot of people have kids, and they are particularly worried about sending them outside, not just in the US, in India and different parts of the world. So could you just tell us about that?
Right. It's something has been recognized. Fortunately, it's very rare. It's not common at all, and it is something that has been seen in very few kids. But it's something can happen with COVID-19. So what happens that few kids who get infected with COVID-19 virus will have spread of the virus to their lungs like everybody else does, but it can also spread to the other parts of the body, like their heart, their kidneys, and their brain. So you're talking about more than one system, more than just lungs. That's why it's called multi-system failure or multi-system disease. And it definitely is something that we have noticed, seen, or we have heard about, seen in patients or kids who have underlying problems like severe asthma. If they have their lung health is not good, they have a lot of asthma and lung problems since childhood. If they are dealing with some kind of, let's say, blood cancer or leukemia, something that affects their immunity is already weak to begin with, then they are a very high risk of having them. It can happen to someone as a normal kid too, but it's very, very, very rare. So it's not something to be afraid about. If the child is healthy, doing well, they are not at a high risk. But if the child is 12 years or older, you still want to get them vaccinated. At least here in US, we are doing it now. We are encouraging all the kids to get vaccinated because that makes a difference. It's a great line of defense. But unless the child has predisposing issues like severe asthma or immunity challenges, the rest of the time, not something to be afraid of. But if the child is not vaccinated and you are going to travel with the child or an event to somewhere, then you want to make sure the child is wearing a mask. You want to make sure to avoid any exposures.
Yes, especially young children, it's very difficult, right? So the question. Thank you so much.
No problem.
One more question we had about how dangerous the COVID-19, especially with somebody with what I call fibrosis of lungs, how dangerous it could be, because this seems like some underlying situation inside pulmonary situation, right?
Right. No, that's a very good question. So yeah, we have seen that the patients who have underlying or predisposing lung problems, which can be asthma, which can be emphysema or COPD, smoking-related lung damage, or if they have pulmonary fibrosis, which is pulmonary fibrosis basically means scarring of the lung. So if you got a cut on your skin, you have a scar, that kind of skin heals in that part with the scar. Similarly, when the lung gets damaged in a way, a lot of things can damage the lungs. It can be infection, it can be allergies. It can be
Mhm.
genetic. But when the lung gets damaged and heals with a scar, some parts of the lung forms a scar inside the lung. That's what pulmonary fibrosis is. So if somebody has pulmonary fibrosis, depending upon how bad the fibrosis is, anywhere from 2, 3, 5% all the way to 50% of their lung may not be working normal. So they are dealing with breathing with anywhere from 80% to 50% of normal lung. So they have lung capacity which is already low. So now you get infected with COVID, and whatever is your normal 40, 50% lung is, that
Mhm.
gets damaged with COVID too. So you have no reserve left to fight until the damaged lung heals. That's why people with underlying lung problems, they have harder time to deal or recover from COVID-19. And pulmonary fibrosis is one of them. That's why.
Got it. Got it. Thank you for the answer,
Yeah, no problem.
Doctor. Uh, there was one last question about the disease part. Is is there any correlation between the stress and COVID-19? You become susceptible to catch COVID-19, or stress during the COVID-19 accelerates the worsening condition in the pulmonary. Like we're trying to find any correlation, studied correlation between stress and pulmonary dysfunction functionality.
Right. So in terms of if you focus on things that help the lung health,
Mhm.
one of the big ones is is immunity. So having a strong immunity is very important when you are fighting with not only COVID, but any infection that affects your lung, which can be flu, which can be pneumonia, which could be anything that infects your lungs. So one of the factors that affects the immunity, which we have learned, is stress. Somebody who's in extreme stress, and you're not talking about stress for a few days, few weeks. You're talking about stress which is prolonged, ongoing, and so prolonged, ongoing stress can affect the immunity or person's ability to have a strong immune response. And if that's the case, then because immunity is not the best, they have a high chance of getting sicker with any infection, not only COVID, but COVID is one
Oh,
of them. You know,
okay.
um, it's hard to describe that. Yeah, if you're stressed for 3 months, you're high risk versus 2 weeks. I mean, it's hard to tell, but
Okay.
stress for a long time can be a part of something that we have seen can affect the immunity. So stress, not sleeping well, again, not eating, healthy food. Again, good to have some fruit, antioxidants, which are part of immunity. Try to work on stress relief. Try to sleep well. If you have trouble sleeping, then try to fix that. These are all together a one circle that kind of boosts the immunity, and it can improve lung health. This is something that's been scientifically proven. Yeah,
Oh,
yeah,
that's a good to know. That's a really
yeah,
good and really helpful for.
yes.
Let me now change the topic from the disease to the vaccine. So, a lot
Yes.
of questions we have found from the vaccine side. So, uh, the first and foremost question was uh, about the booster, as you already probably answered. So, for Johnson and Johnson, are we planning to have? Are we foreseeing booster? Dose, or for
Johnson and Johnson,
any
we
other?
still don't know. Yeah, they are still determining. Yeah, as of now.
Okay.
Yeah. Mhm.
Got it. And one interesting question we found. So I personally have seen, and you yourself came from India as a student. A lot of
Mhm.
students from various parts of the world.
Mhm.
They travel to various parts for studying, right? So what if somebody has got infection in one country, they got vaccine, let's say in India, they got vaccinated, they recovered, then they got vaccinated, and then they travel to, let's say, US or UK. Should they consider getting vaccinated again, or the mix of different vaccines allowed? And how is there any study that is proven that mixing of a two different type of vaccines safe and does not create any catastrophic or any repercussions on the overall health of the body.
Right, right. No, I think that's a very important question, and that's the question that we are still waiting from a strong guidance from CDC. I think CDC is trying to determine this as well. There are some studies going where they are trying to give one booster dose of either Pfizer or Moderna to patients who received J&J, Johnson and Johnson vaccine. Main reason is, again, we know that J&J is, it's not as effective against Delta virus as much as we know about the Pfizer and Moderna virus are. So that's one of the main reasons now that this debate is going on, and there are studies going on. They are taking the, because when they started doing studies, they gave it to all these thousands of patients, each and every vaccine. They're still following all these patients, so they have computer records. So all they have to do is reach out to the J&J patients and say, hey, if you're willing to take a vaccine, one dose, we'd like to give you, and check your levels again and see how you do. So that study is ongoing right now. So I think we'll have some guidance soon. But most of the experts I talk to, most of the infections, pulmonology, all the experts we talk to, and when we discuss, we strongly feel that it's not a bad idea to get a booster dose of either Pfizer or Moderna if you've taken Johnson and Johnson, just to get that extra layer for Delta virus protection. Or if you have taken AstraZeneca from India or Europe, you can take one booster dose of Pfizer or Moderna. Again, we don't have a strong guidance from CDC yet, and I think it will come soon. But most experts feel that's the right thing to do, because people who have done that, we haven't seen any side effects or any damage or any issues.
Prescribe, but we are still hesitant to prescribe, basically.
Yeah, I mean, I have a few friends whose parents came from India. They have taken AstraZeneca in India.
Okay.
And they asked me, and I said, yeah, go take a booster dose of Pfizer, Moderna, wherever you can get. CVA Walgreens here, go take it. Because, we know AstraZeneca is not effective against Delta virus. I mean, they are 65 and older, and they're at risk of, catching infection if they have underlying diabetes, especially heart problems. Then it's not a bad thing to do.
Okay.
Yeah.
Thank you so much. And
no problem.
One more question about the vaccine side. Although we are almost 3 minutes above, but I'll anyway ask because it's really important topic for us, community.
Sure.
So it was about clotting. So we have seen some cases of blood clot vaccination in AstraZeneca or Pfizer, etc. So is there any pre-vaccination prevention we can take related to blood clotting, anti-blood clot medicines?
Sure.
Any clots?
Sure. Yeah, this is something that we early on saw with Johnson and Johnson vaccine. And as you know, for a while, you may know, many of you might know, for a while they had stopped giving Johnson and Johnson vaccine because there was a concern about patients getting Johnson and Johnson vaccine having high risk of having blood clots. But later on, when we looked at the evidence, and then what got published, so the risk of having blood clots with Johnson and Johnson actually is relatively lower compared to anybody who gets blood clots traveling on a long airline trip or has other risk factors, let's say like a surgery. So risk is really not that high. So this is no longer a warning anymore. And we also I think evidence is kind of also pointing that taking something to prevent blood clots, like a blood thinner, can actually increase the risk of bleeding more than preventing the blood clot. So as of now, there is no need to take a blood thinner, or if you are taking a vaccine. I mean, if you are taking blood thinner for your heart problems, for other reasons that your doctor wants you to take, then you keep taking it while you take a vaccine. You don't have to stop it or change your dose. But if you're never taken and you are not at risk, then you don't have to go take a blood thinner to prevent the blood clot because of vaccine. You don't have to do that. Yeah.
Okay. Thank you so much. One last question is probably short. Answer is going to be there. So very simple. In your experience, in your when you talk to patient, why there is a vaccine hesitancy? Why people are hesitated to take vaccine? We see California is still 70%, putting so much resources from the government, in India also, in large countries, like, we still see people are, there is a whole, sector of the whole people which are hesitated to take vaccine. In your experience, your communication with patients, what do you see the reasons are?
There are multiple factors, and this is something I have conversation with my patients all the time. I mean, one thing you have to know is that even before COVID vaccine came out, we always had people who are not believing in vaccine. Like, I have patients who every year I'll tell them to get flu vaccine, even though they have chronic lung problems, diabetes, heart problems. They said, I've never taken a flu vaccine in my life. I'm 70, 80 years old. I'm not going to take it now. I'm not going to take it. So there are always this group of people with years and years who never taken any vaccine. So
Mm-hmm.
they are the same. They are not going to change now because of COVID vaccine is here. So that group is the same. That's not going to change. Then
Okay.
you have the other group, which takes vaccines like flu vaccines or pneumonia vaccine, uh, and they have multiple different reasons. Some of them, biggest thing, some of them are they still feel like the COVID is a hoax. COVID is not a real problem. They still feel like, oh, it's something that is a
Earth is flat.
big thing was done to bring the economy down, and China tried to do something, Europe tried to do something. I don't believe in this, so here we go. There are some people who don't believe in COVID. So if they don't believe in COVID, they are not going to take vaccine. That's one.
Okay.
Second group is there are some group is saying that, are the ones who like to do their own research. So they read online, they do everything, and they say they feel that I'm not going to take it because the vaccine was built too fast. All the other vaccines have been developed over 5, 10, 15 years. And this vaccine was built less than 1 year. So I don't know who cut the corner. I don't know who did what. What if something happens to me 10 years from now? So those are the ones who are hard to argue because they say, I'm going to wait another year and see what happens to people who took the vaccine
Okay.
and wait longer. I'm not going anywhere. I'm home working from computer, especially in the Bay Area. We have so many people working from home. Like,
Mm-hmm.
I'm not going anywhere. I'm getting everything delivered at home. I have no
Mm-hmm.
exposure, so I have no rush to take vaccine. And
Got
then you have another group, which are I have seen younger people who are 20s, 30s, or like, oh, I'm way too young. What if something happens to me 50 years from now? I get COVID vaccine problem. I get then something comes out, the vaccine causes cancer.
it.
And
Mm-hmm.
then I have some, younger women who are, expecting to have kids. And they're like, oh, what if it affects fertility? And what if I can't have kids? So you have all these different groups of people who are like, you can say, non-believers in vaccine,
Mm-hmm.
which are out there, at least in a country like US where we have so much access to vaccine. And then
True.
the rest of the world, well, I mean, like India, now everybody wants to take vaccine, but there is not enough vaccine available. So there is no access. So that's another problem where people want to get vaccinated. They're so scared. They want to go back
Mm-hmm.
to their work and job and, uh, but
Very
now there is not enough vaccine to deliver. There enough good vaccine. I mean, they have other vaccines, but they should get really vaccine like Pfizer or Moderna because we know that's the vaccine that works against the variants. So there is just not enough vaccine there. So access is another problem. So you have all these issues. Yeah.
Could I again interject and ask just one question?
Yeah. Yeah.
There was a question earlier which said that if a person does get COVID and does suffer from some lung damage, what is the likelihood that this recovery will be 100%? Or do they get left behind with some permanent damage?
Yeah. So it really depends. I'm seeing a lot of patients in the office who had COVID last year, February, March, and they are still struggling. Depends on a lot of things. Depends on how healthy they are. If they're healthy before they had COVID, lungs were healthy, no other lung problems, so they will have a very good chance of recovering 100%. If they underlying lung problems, less chance. It depends on how sick they were. If they were sick enough, they were in ICU, they are on the ventilator, they at least have about 10 to 15% chance of 10 to 15% lung damage that might stay for the rest of their life if they were that sick. But the way our lungs are, our lungs have ability to regenerate and recover. So as long as you have, 75% of lung which is healthy working, you can still live and exercise and do everything you need to do. So they still can do that, but recovery time for them is longer. It can take up to a year. I'm still seeing some patients after a year struggling, some developing things like asthma, which they never had. They're getting better with treatment, but they have to be on treatment. So it really depends on, how there is no like one set number. So it can be somebody will recover all the way. Somebody might have, 10, 15% of damage, which might left behind. Might happen, yeah.
One more question, Dr. Pandya. So one of my colleagues, she keeps saying that, to build immunity, keep having, have a zinc supplement.
Yeah.
Is that true?
Not a lot of evidence on zinc. We have some evidence on vitamin C, but zinc, it is just. So we were in the beginning considering to give zinc, but now we are not giving. Yeah.
Okay. A lot of misinformation. So it's
it's
clarified a lot of them. So
yeah, there is information about zinc, hydroxychloroquine, ivermectin, all this stuff, but they are not effective. So, yeah. Vitamin C, yeah.
Yeah, have you heard from your colleagues in India or friends from India about efficacy of the Bharat Biotech that vaccine, I believe, Covaxin or?
Yeah, I've talked to a couple of my friends. Yeah, it's a good vaccine. It works, but we don't have they don't feel that much of effective against Delta variant.
Oh, wow.
Yeah.
Interesting.
So they still see people who are vaccinated and they are getting sick with, so there is a good chance, but it's hard to test over there at large level, but when I talk to them, they feel like it's not effective against Delta. Yeah.
Oh, wow.
Yeah.
Interesting. No, we have gone almost 15 minutes over time. So
yeah.
Shivang, any other questions or?
Nothing else. There are a lot of questions from the virus side, the prevention, causes of the disease itself, the vaccination. I think we are done with all the questions, and we really want to thank you for your time. I will hand over to our team member, leader, Shaunak Maru, of viewers.
Thank you, Shivang. And of course, thank you so much, Dr. Pandya. Someone had made a comment in the chat box. Okay, you are the Dr. Fauci of our community, and I think and I think that pretty much sums up our appreciation of your time and of your knowledge that you've shared with us. We know how deeply knowledgeable you are on this topic, and for you to still relate to all of us who are not as knowledgeable about the details, and in doing it in such a way that we all understand and we are all much more informed about all of this. We mentioned earlier as well how important a topic like this is and how relevant it is in these times, especially with so many of our family and friends being affected here, back in India and in other countries. And so it's very helpful for all of us to have all this information and just to be mindful of and taking care of all of this as we can. So thank you very much once again for your time and knowledge and everything. Thank you to the SVNA team. And of course, thank you to everyone who's able to join us on the call today and everyone else that will be watching the recording. So I'll pass it on to Sharvi Masi to close it out.
Thank you again, Shaunak. Thank you so much, Dr. Pandya, for honoring us with your time. And, he is an extremely busy person. I have not met someone who is as busy, and I am very appreciative of your time. So thank you. We will continue to bring more health-related topics to Otlaa Parishad. I want to just mention that we have Shwetang and Maushami Trivedi, who are also part of our team here, as well as Arjun Trivedi and perhaps Smith Mehta as well. All of you, thank you for all the time and effort that you have spent in bringing and hosting this And of course, no thanks are good enough for our President Kinjal Buch, who goes above and beyond for everything. So 3 cheers for Chirag Bhai. Please continue to partner with us in the future. And we hope to see you when we meet in person.
Absolutely. Let me know anything I can do to help. Thank you so much.
Thank you. Thank you, everybody.
I think
excellent. Thank you very much, sir. Well done.
You know, they've done an excellent job with this presentation. So thank you so much, everyone.
You're welcome. Thank you.
Bye.
Thank you.